counters. And about the mask also, the face mask, I've seen people using it, but I don't know what advice is coming from the ministry, whether it is now time to start using it, and what are the advantages and disadvantages. And finally, on communication, yesterday I had to call Kevin Modu and other people when there were reports that the people needed to close their houses because they could create the country. So I don't know if the ministry is thinking of coming with steps to counter false information as and when they are released, because these information are always going on. Whether there are also measures, to address those things. We have seen in some of the African countries, people were charged for just spreading false information. So I don't know to what extent the ministry is taking. Thank you very much.
People were sacked, you say?
In one of the African countries,
sacked for spreading false information.
Well, okay, thank you very much. With the quarantine centers, I must say, when it started, this is a new thing, so there were challenges. I don't think any country had quarantined this number of people in their own history that we are seeing now. Probably not in the modern times. So quarantining people is a big challenge everywhere in the world. Now in the Gambia, when this situation happened, the first instance, we only got to know about the arrival of the flight just few hours before the arrival. That's when our people started looking for a place to put the people. So it was a big challenge. Now, when they did that, at the beginning, the hotels did not even want to accommodate them because they were thinking of their brand names. No hotel wanted to be labeled Corona Hotel. So we had a big difficulty getting hotels to accept to quarantine them. But as they became more and more informed that after the evacuation of those people from their hotels, the necessary measures will be taken and their hotels will be used again. So that is how they opened up. And in fact, all of them have been very helpful and very, very nationalistic in providing their hotels for them to be used. So those teething problems were there at the beginning, and there was a lot of improvement. But I must say, when we do things in Gambia, let's also look at what happened elsewhere. You see, let's also not look at Gambia in isolation. We have known that there are countries where they said they were going to quarantine people, and they said those individuals were going to pay for their own hotel fees. And I'm sure you've seen those in the media. We had seen a country too where when the people said, another country said the people were going to pay for their own quarantine fees to the hotel. The people did not agree, and you know what they did? They took them out and took them to a primary school. That is a reality in an African country. We never dreamt of that, and we'll never dream of that. So our people are in hotels. They had challenges initially. Those challenges have been resolved. But you also know that some of them are in, which hotel is it again? The Sun Beach Hotel. Sun Beach Hotel, is it not a good hotel? Sun Beach Hotel is a good hotel. So as the numbers increase, we incorporate more and more hotels. We want the best for them. It is not a punitive measure. It is not. In fact, it's actually protecting them and their immediate families first. Because if there is going to be interaction, we interact more with our immediate families first than the general community. It is expensive for government to quarantine. It takes a toll on our health staff to monitor these facilities. You can see we all hardly sleep. We don't sleep much, all of us, the entire team. But it is in the interest of the public. That is why the quarantine is being carried. But I must say, I think there is increasing understanding now. Those who are under quarantine, they appreciate. Most of them appreciate the fact that it is in good faith, and we all just waiting for the time to elapse. Very soon, some will be allowed to go back to their families, and that is our prayer. That is our wish, that they all go back to their families without encountering any problem. So, yes, we'll discuss with the team with regards to the media visiting the quarantine centers, so you'll see for yourselves, what is there. I'll discuss with the team. I cannot make that unilateral decision. I'll discuss with the team so that we see what the best practice is. So you get there. I've forgotten the other one. Yes, so there are guidelines as to when we should use the various protective, gadgets, protection gadgets. And so those guidelines, in fact, we have the WHO recommendations when you use the mask, when you use the gloves, when you use the full gear, so we want to circulate that to you. It's upstairs, so you all read it, and so you are in a better understanding, so you also appreciate, so that we can also use these protection materials judiciously. Otherwise, the chances that we run out of them, and then when we need them, we won't find them. So we will share that with all of you, so you can also use it to protect, to help in the protection of all of you. When and when to use the mask, when to use the gloves, and so on and so forth, right? Good.
Thank you very much.
He had another one that escaped my mind.
About communication.
Yes, communication. It really puzzles me why people would like to give false information. I still cannot understand. And I'm sure you also don't understand why people want to give false information. But, human beings, they do things for various reasons. Of course, a lot of them not justifiable. But we want to encourage them. Of course, this is a democracy. So we want to, by all means, maintain the liberty of the people to freedom of expression. But I think it should be used judiciously for the good of the people. So when they circulate false information, it is not helpful. It's not helpful, and it does more harm than good. However, someone sent one message to me about the spraying too. But what I noticed there, they say the federal government. We don't have a federal government here. So I thought probably it was not meant for Gambia. It was meant for another country, and then someone just took it and then was circulating it. But we urge all of you, because you can also advocate, so that, the media is very instrumental in spreading the right message across. So use your own media and your own your capabilities, own strategies to make sure that people try to get information from the right sources. Thank you.
What was the question about
difficulties in
moving them from the community?
Moving people from their homes is not so easy, into quarantine centers. Or people come from a journey expecting to get together with their families. We say, no, you cannot just go and stay in a hotel for 2 weeks within the country. All those are not easy for individuals, and it takes time for some individuals to agree. So yes, there are challenges, but there is dialogue going on to make sure. But what we can tell you, the information we are getting from our people, is that they are confined where they are already, so that there is adequate social distancing before we finally move them to a quarantine center. Yeah.
Director, you want to say something? We have a lot of work to do, so tomorrow you can reserve. Director, you want to make say something? Oh, you want to
I'll allow one or two.
Okay, Minister, allow it.
Before you come in, okay, one of them can come in. Aisha, you got your opportunity yesterday. Okay, you can come in.
Good afternoon. I am Aisha Tijjal from Gambian Talents TV. Honorable Minister, we see that the President will be addressing the nation at 8 p.m. tonight, but only for TV stations mentioned, that is GRTS, Paradise, QTV, Star TV. Star TV, the online TVs are going everywhere to provide maximum coverage for the COVID-19. Why is the online not included to cover the President's address to the nation? And the second question is, the government is encouraging Gambians to stay in their homes as much as possible. But we all know that the average Gambian family depends on the breadwinner going out to do some rubber on daily basis before they can put food on their table for their families. what is the government going to provide support to families to stay home? And why do they need 2 bridges instead of 1? What will the president talk about that is different from what he said?
Well, first of all, the first part of your question should have been directed probably to the communications officer or the director of media relations at the OP. And you can put forward a case to her. She would be able to be what the president is going to say. I mean, the speech hasn't come out yet, so I wonder what you want me to say about that. So we all await the speech. I will also be listening to it. So today we'll be glued to the TV to watch what is going to be said, so that we all understand it, and then we act accordingly. Yeah, but I think with regards to what is happening in Gambia, yes, we all know the way our people work. People work on daily basis to earn a living. So that's one of the challenges we have as a nation. So sometimes you understand when people call for certain things, these are the challenges. And I think those are all being looked into. One thing I can tell you is that we have a very considerate government that looks at all those points, all those facts, looks at the people who need to go and work on daily basis, and what they get is what they take to their homes on daily basis. The government looks at all that, and they also look at the fact that some people have a lot of challenges in feeding. And the government, I know, is looking at all possibilities to alleviate the suffering of the people and to mitigate the impact of COVID-19 on families in the Gambia. The government is seriously looking at that. But I urge all of us to wait for the statement by His Excellency. So we're all going to learn a whole lot of points from that with respect to what we need to do subsequently. So let's wait for the statement. Thereafter, we can analyze it and answer more questions.
Final question for the board, and then we wrap up for this.
Yeah. So the first thing is the border between the Gambia and Senegal. Yeah, we know the borders are porous. We know there are villages that part of the village is in the Gambia, part of the village is in Senegal. This is the nature of the situation. But what we do is, first of all, to enlighten the people. We enlighten the people that the borders are closed and they should respect that. But the official border points, are manned by the various security personnel to enforce the closure of the border. Now, the unofficial border points are the challenge. We all know it is challenging to man those points, but of course there is hope to be patrols. We expect patrols at those various points. The Interior Ministry and and the various other sister agencies are looking at patrolling other sites, to make sure that these other entry points are closed as well. But I think you also understand that it is a big challenge between the Gambia and Senegal. These are the realities of life. Sometimes you have these difficulties. Manning the entire border is going to be very difficult, but we would like to continue the sensitization of the people that the borders are closed, so that there isn't that entry through the unofficial border points. But we still continue to be vigilant. We monitor the people who come into our communities. When people cross the borders, they don't cross the border to stay in the bush. They cross the border to go to the communities. So those communities should also help the enforcement agencies. They enforce the border closure. They cross the borders to go into the cities, into towns. So those people in the town should also help the enforcement agencies to enforce the border closure, because government is not closing the border because government enjoys border closures, because that is a step, an important step in our struggles against the COVID-19. Now, coming to the other question, preparedness, I keep on saying, is a process. It's a process. You do what you can with regards to within your means, within what you have, within your resources. And then when the cases come, we pray they don't come. More cases do not come, but you deal with them as and when they come. Now, what we are doing is we are getting a lot of equipment in our preparedness. We are getting a lot of ventilators. We have some ventilators currently. Some have been installed and others are being installed. But we are not stopping at that. We are procuring a lot more ventilators. We are procuring a lot more intensive care beds. We are procuring a lot more protective gadgets. So the procurement continues whilst we await for any eventuality. So it is our strategies are being propped up, and we are trying to increase our capabilities of dealing with cases as and when they arrive. We are fixing the treatment center, is being renovated, we all know, and other centers are in preparation just in case the treatment center is full and we need to use other facilities. So the preparation in that aspect is still ongoing.
Thank you very much.
Some have been tested and others are not.
That was the Minister of Health there on the press briefing updating Gambians on the situation of coronavirus in the Gambia. So stay tuned with Africa. Next up is the news.
The idea about the quarantine is there are...
Gambia's health minister has confirmed that the number of people who are tested positive of COVID-19 in the Gambia still remain at 3, with 1 probable case. Efforts to stem the spread of the coronavirus is paying off in Egypt as authorities threaten health facilities. South African government has outlined plans to mitigate the impact of COVID-19 on the economy. This and more coming on the world today. Hello, this is iAfrica TV and it is 17:18 GMT here in our studios in Banjul. You are watching the World Today News Bulletin on iAfrica TV. I am Amadou Kante and now the news in detail. You have been just watching there the update on the coronavirus in the Gambia by the Health Minister in the ministry in Banjul, and we will go live to Banjul and of course talk to our man on the ground, Ibrahima Prespa. Ibrahima, the Minister just conclude the daily press briefing on the coronavirus situation in the Gambia. The probable case still not yet confirmed.
Indeed, no new cases confirmed after the 3 cases confirmed during the week. There is no additional case out of 53 tests that all proved negative. So according to the minister, the second case that was confirmed in the country happened to be in connection to the probable case which is yet to be released. So that is a Bangladeshi national who, contracted with the late man who died on Sunday. We tested first time. The results were not clear because initially it was said to be positive. Confirmatory results said he tested negative. So now the second test is being conducted on that Bangladeshi man who visited the Gambia via Senegal. So the minister is still hoping that in hours to come, the confirmation will be done by the ministry.
Well, the Honorable Minister also shed light on the 500 million pledged by government. What more can you tell us about that?
Indeed, when it comes to the statistics as to number of cases, number of tests, number of confirmed cases, the ministry with its own satellite institutions, including the directorates to the top brass in the office of the minister, they are all in line. But when it comes to the money, figures about money, there is no news is coming because the minister has just told us that he cannot tell as to how much has been spent so far. We remember on the 17th March when the president addressed the nation, he said that money will be done and he empowered the minister to execute that. Today, the minister will tell us that quarantine centers have been paid for, procurement is going on, and there are also a lot of spending going on, but they cannot tell us at the moment how much spent so far.
All right. The issue of public gathering has been a big concern for many, and the minister yet again urged Gambians to be more cautious.
Exactly. Institutions are still operating. Government officials, government offices are functional. We know the one like the National Assembly closed earlier on, including also the Truth, Reconciliation and Reparation Commission. These are few institutions who shut down transmission, but the rest are definitely operating. So now the concern is as to what measure is in place to enforce the social distancing at work, since these institutions, both government and non-government, continue to go to work. So what measure is being taken? What are the sanitary equipment given to them? What are the coping gears that the workers are having for now? What is being provided by the ministry? Disinfecting a case like spraying grounds and disinfecting work appliances. These are all questions that the minister continued to say that it is left to the people to definitely observe social distancing while at work. But how, that question was not clear today.
Now, finally, we understand the president is going to address the nations later tonight. What can we expect from his message?
This will be the second time the President Adama Barrow will face the nation since the outbreak of coronavirus in the Gambia. We remember on the 17th March, he gave a televised address via the national broadcaster GRTS, where he, outlined some measures, banned public gathering also, and then advised people to adhere to the advices from health technicians. So today will be his second time, and the nation is all ears to him. Whether he will bring information different from what the minister has just said to the media today is not yet clear, but whatever the case is, Gambians are anticipating that President Barrow will bring goodwill message to the Gambian, especially at a time when 3 cases have been confirmed. 1 probable case is on the offing. So President Barrow will be listened to, and iAfrica will feature the live broadcast later 8 o'clock today.
All right, thank you very much, Ibrahim, for your update live from the ministry in Banjul. And from that update there, we will next move on to Egypt, where the Egyptian government decision to partially close the country's border is paying dividend in their efforts to curb the spread of the deadly coronavirus pandemic since the confirmation of the first case of COVID-19 in the North African country. Health authorities have been scaling up efforts to remedy the level of impact of the disease. The government has further equipped health facilities in different parts of the country to lead the fight against the virus. Let's have more details of that in this report.
In its sixth week of fighting COVID-19, the nation is in partial lockdown, fearing infection rates would get out of control. On Wednesday, Health Minister Hala Zayed proudly announced that so far, Cairo's policies have been successful in flattening the disease's curve.
All our measures so far have been preemptive and preventative. We didn't wait like other countries which took reactive steps after it was too late. The Egyptian government has a plan for every scenario. This has been one of the main reasons why our infection rate curve is not so high.
In average, Egypt's COVID-19 infections have increased by about 28 cases daily. With a half-day curfew imposed on Wednesday, the government is hoping to at least keep that rate steady.
Our focus in the past week was to track down infections until our investigations reach the case index for the centers of infections. We've exerted huge efforts in that track to link cases together so we can have effective quarantine.
To prevent clustering at healthcare facilities, the Health Ministry announced new supportive measures. Public insurance services will be releasing 3 months of medicine for Egyptians with chronic disease. When the outbreak began in Egypt, Cairo was the only city equipped with a testing center for the virus. Today, 21 cities are ready. Egypt is working tirelessly to keep being a step ahead of COVID-19.
And from that report there in Egypt, we come back home because Serekunda market vendors and those along Kairava Avenue have criticized the police for what they call their prompt order for them to close their business in the enforcement of the president's decree on the ban of public gatherings on Friday. But spokesperson of the Gambia Police Force said the vendors were misinformed about the mission of the police in the area, saying they were patrolling to see what the social and public gatherings are minimizing and to monitor shopkeepers who are hiking the price of the commodities. Let's have more of that in this report.
Spokesperson of Gambia Police Force, ASP Lamin Jai, has told iAfrica TV that the presence of the anti-crime unit of the police at the Serekunda Central Market on Friday morning was not meant to order vendors to close their shops and everyone to vacate the place, but it was part of their routine duties. The police presence at the market was described by the vendors as an order for them to vacate the public place, coming from a presidential decree to ban all public gatherings as part of measures to prevent and control the spread of COVID-19 pandemic. One of the vendors said the way the police confronted them was not right, saying authorities should feel the difficulties that people are going through and empathize with them instead of sending them from where they are living.
Political impassment amira ya da la fole ya understand nyin kura min farna ya da la fole ya understand ela bala firmo la baro la nyanda diamula ke ba may dafa ma nyanda diam baro la nyanda diam baro adolon seydi ndolo carrière diatella adal nyanda diamula bara man fin ka diam abesira fu ha man bu day ba da talal.
Omar Njai, Chief Executive Officer of Smartphone House, told iAfrica that he was ordered by the PRU officers to close his shop, and few hours later, he was asked to continue operation. Many shops along Kairaba Avenue were said to have been ordered by the police to cease operations, which was later lifted. But police spokesperson Njai said the vendors were misinformed about the mission of the police in the area. He said they were patrolling to see that social and public gatherings are minimized and to monitor shopkeepers who are hiking the price of their commodities. According to him, the mission was not about ordering the vendors and shopkeepers to vacate the market premises, assuring them that they will not take any such decision until they receive the orders to do so. Another vendor said it is disheartening that the police just came one day to order them to stop their businesses without giving notice.
Tay mom moy lolu quoi gis nga marché bi ni la ko gaay yégué tay ñew nañ déclarer 9h ma bi job amul ta xamane li da am mbir bokay def dang koy déclarer gaay média yang fi da ngay tok ci média bi nga ne len bis nangam li mo happen ya understand bu ko defé gaay mëna xamné ni la fa démé wa ndax nelaw yi ñu yaq depuis ca fajar ba légui ñu tok ci marché bi nga ñew ubbi wo ta xamoo lo bayyi sa kër xamoo no fa joggé tamit neexul ci xol quoi.
Kanifing Municipal Council spokesperson Aisha Fall described the event as miscommunication, saying they have contacted both the official of the Inspector General of Police and the Police Intervention Unit, but both said they did not give any order to ask shopkeepers to close and everyone to vacate the market. Reporting for iAfrica TV News, I am Aminata Job.
And from that report there, we will now take a break and come back shortly with the remaining of the stories. Stay with us, we'll be right back. Welcome back. You are watching the World Today News Bulletin on Africa TV. And now to the rest of the stories. Now, Gambia Marca Center said it has taken the death of the Bangladeshi man who was confirmed to have contracted coronavirus disease in good faith. The 70-year-old man, who was among a team of Islamic scholars who entered the Gambia via Senegal over coronavirus-affected countries, including Senegal, died on Sunday and was confirmed positive of the coronavirus after his death. Let's have more of that in this report. The Marcus Center has given reaction to the confirmation of positive test of COVID-19 of a Bangladeshi who was hosted by the center in Bundung. The man who died on Sunday was among a team of Islamic scholars who flew into the Gambia via several other coronavirus-affected countries, including Senegal. Ibrahim Jabang, who spoke to Africa, said that the Islamic Center received the news in good faith and that all those who had contact with the late scholar voluntarily gave in for quarantine and testing.
Yeah, we got the information the same way the public got it, that he tested positive. So, and then from there on, we just had to listen to the government, the health experts, to tell us the way forward. And since then, they have been coming and going, and we've been compliant. The first contacts were identified, and then they went. And then there are a number that voluntarily, knowing they had contact with the guy, without government's intervention, came, and right now they are also under quarantine. But Alhamdulillah, Allah being so good, so far, all Gambian brothers tested for the corona as per the information relayed through the minister yesterday. All cases are so far negative, pending one that the minister said is inconclusive.
A delegation of about 15 members of the Marcas were allowed to offer the funeral prayer on the late Bangladeshi who was laid to rest on Wednesday. His funeral was managed by the Gambia Red Cross Society. The management of the Marcas anticipated some form of solidarity on the passing of the scholar rather than painting a picture on the center.
A disease that's no more an epidemic, but a pandemic for that matter. We wouldn't recklessly let it loose at society. Especially a society we are part of. Now, Allah, out of His own decree, made it such it came from us. Now, what can we do? The only thing we can do is to cooperate with the health experts to see the way forward. And so far, we are definitely cooperating with them. Our image, yes, it's been tarnished. People who have never even met the Sheikh, people who have not even come here for the past, let's say, a month or two, are being stigmatized. We expect Gambians as brothers to be in solidarity with us. We have seen people being in solidarity with the Italians, with the Germans, with the Chinese.
Of the close contacts of the Bangladesh national, one contact has been subjected to test for a second time after the first trial was inclusive, according to the Minister of Health and Social Welfare. But lab technician at the ministry, Haruna Jallo, explained the reason for the second test on the primary contact of the man who died of coronavirus.
In the testing, you have a platform that is the real-time PCR. So the reason why the patient is a probable case at the moment is because the screening tests have shown that it is positive, but the confirmatory test is saying it's negative.
So far, 3 cases have been confirmed in the Gambia, with the government working on to enforce the ban on public gatherings across the country. Reporting for Africa News, I am Amadou Kante. And from that report there, next we head to South Africa, where the government is discussing measures to deal with the economic impact of COVID-19 pandemic in the country. About 150 million rands is budgeted by the government to support the public during the tough time of the coronavirus, in which many sectors, including agriculture, would be considered in the package. Let's have more details of that in this report.
Recently unveiled its national budget, seen by many as frugal and tough. The coronavirus couldn't have come at a worse time.
Uncomfortable because the current appropriation that we passed in February, we can still work around that. Even before the president sends that into law by the 31st of July, there are still processes that we can, via money, in terms of using the provisions that are there currently. It's early days to talk about a special appropriation.
Government will pump 150 million rand, or around $8 million, into a newly created fund that will take a holistic approach to assisting as many people as possible.
It's to alleviate the suffering and distress caused by the virus to the country, and to mobilize the support of business and civil society in support of government's efforts. Government made available an initial 150 million rand as seed funding, and a number of businesses have already today contacted us, because they will be contributing within the next few days to the fund.
The agricultural sector will also get some support.
We are working with the Land Bank, and 100 million will be transferred to assist farmers under distress, those that have got loans with the Land Bank. And I hope that the other financial institutions will also make arrangements to ensure that farmers who have got loans with them do get supported during this tough period.
One of the areas of concern in terms of budget is the support being provided to the ailing national carrier, SAA, which is currently in business rescue.
SAA came into this virus impact, obviously very dented. So it's important that we look at that, but we will keep closely what's happening there and ensure that, if possible, as we said initially, that where possible, if the airline has to be saved, it has to be. If it cannot be because of many conditions, we'll also consider.
The plans announced at the ministerial briefing need a little bit more work and fleshing out, but once they're put into action, it's likely to see many sectors of the country's economy starting to get some support.
From the report there in South Africa, finally we head to Nigeria, where 2 young innovative Nigerians are using technology for early detection of breast cancer. One of them was diagnosed of the disease, leading to the desire to advance that device that can be used for early scanning of the disease. The duo in 2019 won the USPF Change Maker Award and also received support from a mentorship institution that empower young entrepreneurs. For more of that, we go with this report.
Working from this room, Mustafa and Rabiu brainstormed on ideas to detect breast cancer. A relative of Rabiu had been diagnosed of the disease at an advanced stage, so he desired to create a device that people in rural areas can use for early screening and begin treatment. After deliberations and research, they came up with BS Scan, an innovative breast cancer detection device infused into bras.
I came with the idea like, since it's in a village, it's hardly for them to come to the hospital to even get a diagnosis. That would lead to the seriousness of the cancer. So I just say, okay, how can we create a device that will be easy to be accessible from everywhere in the country or everywhere in the world. We came with the idea, okay, we can use bra. It's an easy way which women can put it, so you can take the tumor from the breast.
In 2019, both of them won the USPF Changemaker Challenge, and they received over $2,000 for that. But they didn't do it alone. They received lots of help from Dicebox Innovation Hub, popularly called D-Hub. It's a tech startup incubator that provides mentorship, funding and training opportunities to tech entrepreneurs, something that is not common in northern Nigeria. Based in Kano State, northwest of the country, it was founded by Idris Dangana, a trained teacher passionate about tech and tech talents.
Since we have like a consulting company, the little resource we gathered, we try to invest it back to the hub so that we can sustain our daily operations. At the same time, immediately we find someone with the talent and we give him the necessary tools required. We now try to make him a startup founder by either him coming with some idea, or we try to see what he's doing and show him the possible ideas that he can drive out of that. And from there, they form a startup and they start making, so it's like a self-sustaining kind of a thing.
Organizations like Facebook have invested resources to support D-Hub, but the incubator still needs more support. Idris and his partner want the government to invest more in tech talents if Nigeria is to live to its name as Africa's giant.
If you can harness these potentials and create this, you are creating more impact, not only in Africa, not only in Nigeria, Africa, but the entire world, because look at how people all over the world are trooping into Africa in search for talent. And because of what? Because of, there's teeming youth and there is potential.
The Hub has trained and empowered over 5,000 individuals, including startup founders and tech enthusiasts. Idris's projection is that the startups incubated at the Hub would go on to build innovative solutions for Nigerians, solve the country's unemployment challenge by creating job opportunities, and empower others with digital skills.
That report there in Nigeria would, of course, certainly bring this news bulletin to an end. But for more on this and other stories, you can also log on our website on iafrica.tv. Remember that the president is expected to address the nation later tonight, and of course, you can follow the address live on iAfrica TV. But for now, many thanks for the pleasure of your company, and bye for now.